Our next speaker is Dr. Ria Mulherkar from UPMC Hillman Cancer Center. Welcome, Ria.
Hi, everyone. Thank you so much for allowing me to participate virtually, and thank you to ROECSG for the opportunity to present this quick pitch. Everyone has had great and really interesting presentations so far. My presenting of a work in progress. And it's a collaboration between myself, between Dr. Scherer at UCSD, as well as Dr. Berrywall, who's also in Pittsburgh. And I'm a PGY4 resident in Pittsburgh, Pennsylvania. And so this project centers around developing a standardized modality for assessing contour competency. And as a pilot, we're starting in the space of gynecologic brachytherapy. Thank you. So just as a little bit of background, currently the way that radiation oncology residents are evaluated during residency, there are a few objective ways, and I think the written and oral board exams that are administered by the ABR are probably the most objective ways of assessment. We also utilize the ACGME milestones framework, which gives a numerical score, but that is based on evaluation by an attending at the end of each rotation, and then a group evaluation by the clinical competency committee. Some of the problems with this framework is that the CCC evaluation can end up being somewhat subjective, and there's actually evidence that competency assessment forms tend to vary between programs. So it's not the most objective assessment. And additionally, current modes of evaluation don't fully assess practical aspects of radiotherapy, including the simulation, how we want patients to be set up for treatment, how we contour treatment planning, other than what is observed by the attending during our rotations. And this is especially important in a field such as brachytherapy, where there's also evidence and residents report lower confidence. And so what I'm presenting is kind of an idea that we have for a project, and we're working on obtaining funding for the project. So in terms of the research question, the goal is to develop a standardized method to objectively grade and assess contours that are created by rad-onc residents, and utilize them for competency-based assessment. And in this case, we are focusing on gynecologic brachytherapy, which has been identified in multiple studies as a weak spot for rad-onc residents. So we would first like to develop a platform where residents can practice contouring, and have sample gynecologic brachytherapy cases where applicators are in place. And this is where the collaboration with Dr. Scherer comes in, because he is working on the eye contour platform, and there are others working on this as well, and it's being studied in other studies as well. From there, we would like to have a contour review from an expert in the field, and that's where Dr. Berrywall and other gyn brachy experts come in. For the expert review of contours, we anticipate using a 3-tiered grading system that's adapted from clinical trials, so acceptable versus minor deviation versus major deviation. And then from there, we would like to identify surrogate measures for assessment. And if we can go to the next slide, I can elaborate a little bit more on those there.
You have control.
Oh, okay. There we go. Sorry about that. So from the expert evaluation, that'll kind of be our quote unquote gold standard of contour evaluation. And the 3 experimental methods we're looking at are, number 1, using a rubric that's generated with expert input, have a quote unquote novice, or in other words, an attending that's not considered an expert, review the contours. Number 2, utilize something like a digital metric, such as the dice similarity coefficient, and utilize that to assess contours. And then number 3, which is the most involved, is to actually program an artificial intelligence-based software designed to emulate expert feedback, and similarly use that 3-tiered grading approach to classify contours. Our hypothesis is that one or more of these 3 experimental modalities will result in evaluations of contours that do not significantly differ from evaluation of an expert in the field. And then hopefully, if this is feasible and practical, one or more of these modalities can actually be utilized for competency-based assessment. And then if that is so, and if they are demonstrated to be practical and feasible and equivalent in nature to contour review by an expert in the field, then hopefully we can start to apply this to other disease sites, and also to other aspects, other practical aspects of radiation oncology practice, including simulation and treatment planning as well. And I just have some references, and that is all I have. So thank you again for everyone's time and attention. And I'm happy to take any questions if there's time.